Thank you for allowing me to interview you, Dr. Martin.
All right. I'm glad to be here. Thanks for the invitation.
So our past few governors have had business backgrounds, but you have a medical background. How will that training translate to the governor's office if you win?
So I'm a critical care doctor. That means I work in the intensive care unit of hospitals, taking care of the sickest people in the building. And I know what it's like to work in a big system where you have to bring a lot of different people together to try to help individuals with life or death consequences. And I think those skills are directly translatable to government. I'm going to be working in a big system to try to help lots of people live better lives. And listen, government is not a business. Businesses are all about accumulating money for themselves and accumulating wealth. That's what our governor has done as governor of the state of Tennessee. I want to take the opportunity to use government to help people and to help everyone live better and safer lives.
So we know that one of the main reasons that you are running for governor is the state's response to the pandemic. Are there other reasons?
Sure, there are other reasons. So you're right about what brought me to the table. I work in Sumner County, a little 18-bed ICU up there doing critical care medicine. I had to say goodbye to more than 400 human beings during the COVID crisis. And I know we could have done better for them with an ounce of leadership from Governor Bill Lee and some truth-telling on his part. But look, this race is not about COVID, it's about leadership. And the lack of leadership is pervasive. We need leadership when it comes to public education. We need leadership when it comes to healthcare more broadly, like helping people get access to healthcare that doesn't break the bank. We need leadership when it comes to getting broadband internet and every zip code in this state, regardless of the color of your skin, how much money you make. We need criminal justice reform. We need leadership across the enterprise.
So if elected, what is the first issue you will address?
I think the very first issue we need to tackle is, well, it's hard to break it down, but I think healthcare is central to everything else. You got to have healthy people who can go out and work and provide for their families. And also, if you can help people get access to healthcare that doesn't break the bank, then you're creating an environment where businesses want to come to your community. But right there with healthcare is a great public education that stays public. We need to support our public teachers, public school teachers.
On education, you blast Governor Lee for starting the Education Savings Account program. He says that it gives families more options. What do you say?
So education savings accounts are also called voucher programs. And vouchers take money, public dollars, away from public schools and divert them to private schools. Now look, what does that leave the kids behind in the public schools? It leaves them with less resources, less money. I believe that if we want to provide great opportunities and great options for every child in this state, that means investing heavily in public schools, paying our teachers a salary commensurate with the work that they do, not firing teachers for teaching American history the way it happened, not having book burning parties and having our libraries edited because of a political ideology. We need to fully support our public schools, and I'm committed to making that happen as governor.
Well, Dr. Martin, financially, the state is in a good place with higher than predicted state revenue. How would you like to see that money be used?
Look, I don't want to disturb the business climate in the state of Tennessee. That is what generates our prosperity. But I think my difference with the governor is, what do we do with that prosperity that's been generated? While we're sitting on billions and billions and billions of your tax dollars and what they call a rainy day fund, we're 46th in the nation when it comes to funding our public schools per capita. I don't just want to beat Alabama in football. I want to beat them in public school funding. Let's do it together. I don't want to live in the state that is #1 in the nation when it comes to medical bankruptcies. We are breaking our families with medical debt. I don't want to live in a state that's #1 in the nation when it comes to hospital closures. We can do better by putting some of that money to work for people. We also have another big pile of money called the TANF funds. This is called Temporary Assistance for Needy Families. It's a pot of money that we could be using to take care of families in need in our communities. And I'm talking about food assistance, aftercare assistance, so that parents don't have to choose between a job and having a family. There's so much more we could do to take care of one another. And also, let's look at DCS. We got kids sleeping on the floor in Department of Children's Services offices. We've got, rape kits at the Tennessee Bureau of Investigation, 30, 40, 50 weeks behind processing, because the governor has underfunded those agencies. We got to take care of one another.
Well, Lee's campaign is focused heavily on the economy. Are there other issues his campaign is omitting?
Absolutely. The governor loves to show those ads of all the cranes building, Tennessee, and he likes to talk about the billions of dollars he's accumulated. What he didn't tell you is those cranes, they're only in Nashville, right? The prosperity is only in Nashville. How do you get prosperity across the state? We believe in this campaign that Tennessee should be the land of opportunity for you, regardless of the color of your skin, how much money you have in the bank, regardless of your zip code, who you choose to love, or what your native tongue is. And to do that, you have to invest in people. You have to take that money and give people options, and that's public education, access to health care, great infrastructure. And also, I think we need to quit attacking marginalized communities in the state of Tennessee. Our governor has been all too willing to attack our populations of color, our immigrant communities, our LGBTQ plus neighbors, and I think we can do better to take care of one another. Common sense and compassion, that's all it's about.
Well, lastly, Dr. Martin, what would you like to say to voters?
Here's what I'd like to say to voters. We have an opportunity to change the tone here in the state of Tennessee. We have an opportunity to create a state that works for everyone. And to do that, we have to get out and vote. People are saying, now what are you doing running in this state as a Democrat when you know it's a deep red state? I don't believe it's a deep red state. I believe it's a non-voting state, and we can make a difference if we get out and let our voices be heard in the ballot box. There are a lot of people who benefit from chopping us up into groups. West Tennessee, Middle Tennessee, East Tennessee, white Tennesseans, black Tennesseans, brown Tennesseans, rich, poor, urban, rural. Don't take it. Don't take that bait. There's so much more that we have in common as opposed to that which divides us. That's the number one lesson I've learned after more than 50,000 miles up and down I-40, visiting all 95 counties in the state of Tennessee. Together, we can create a state that we can all be proud of. Just got to get out there and let our voices be heard at the ballot box.
Well, Dr. Martin, I really appreciated our conversation. Thank you so much.
I am so grateful for the opportunity to be here with you. Great job tonight, and look forward to seeing you again soon.
Thank you.